Today, we're kicking off Black Maternal Health Week, and we're not only doing it here in Delaware, we're doing it across the nation because this is an important topic about what is impacting our pregnant women, our birthing people, and how this impacts families and communities. It is with the utmost pleasure that I am here with Dr. Meena Ramakrishnan. She is an epidemiologist here in Delaware, but also an epidemiologist that focuses on the facts. She is part of the Delaware Maternal and Child Death Review Committee. And so we are honored to have her presence here and to educate us on what's happening, what is happening specifically in the numbers here in Delaware and across the world and the country, but also how we can combat these issues that are happening so that everyone returns the joy into pregnancy, motherhood, the postpartum period. And, we can just kind of smile at, our swollen feet instead of the fear of dying while they have the best day of their life, the miracle of their life when they have their child. So please join me in welcoming Dr. Meena Ramakrishnan. Hi, Doc. How are you?
I'm doing well.
Please educate us on what's happening across the world, across the country, and here in Delaware.
Well, I will start locally, if I may, because I think we do have some robust programs and partnerships here in Delaware. At the Delaware Maternal and Child Death Review Commission, we do the grim but necessary work of looking at the worst possible outcomes in the effort and the hope that we learn from them to make recommendations and develop stronger systems that support women, children, and families.
So tell me a little bit more about the committee. So who's on the committee? What do they look like? And does every death get counted and evaluated? And do we create recommendations so that this prevention occurs and it doesn't happen again?
Yes, I want to say from the get-go that we do try to make actionable recommendations. That is the real mission and drive behind our work to prevent untimely deaths. In Delaware, we luckily have legislative protections to review every maternal death. That's the death of a woman while pregnant or up to 1 year after the end of her pregnancy, irrespective of cause. So it could be a cancer related death, a motor vehicle collision, whatever the cause may be. If it falls in that time frame of her being pregnant or up to 1 year after pregnancy, we will review it. We also look at fetal and infant mortality or stillbirths, as fetal deaths are more commonly referred to. Now in Delaware, we can't review all of those deaths because they're too many for the size of our commission and our volunteer review panelists. So we do a random subset, about 50% of the infant deaths that occur every year and stillbirths get a full review. We also look at any child deaths that occur before a young person in Delaware turns 18. So they may be sudden, unexpected infant deaths, but also they include youth suicides and homicides, natural deaths up to the age of 18. So we take a full look, and the beauty or the advantage of being under one commission is that we really can start seeing some of the intergenerational and familial risk factors, from child death reviews that also are similar in maternal deaths. And I think that makes for a stronger holistic consideration of some of the prevention opportunities, really trying to support families, young parents, understanding the important bond of a mother and child dyad, starting off strongly and well supported.
And I think what's important is that you're giving a voice to the voiceless. This person is not here anymore. And so we want to make sure that their birth mattered, their life mattered, right? And so in doing this, we create kind of opportunities to make sure it doesn't happen again. So I know you're an epidemiologist. Can you just ground us in some of the numbers so that we kind of understand the stats on what is actually happening. And, you know, as the young people say, in real time. We want to know what's happening in real time, because this is the audience that is hearing us, and they want their lives to matter in real time.
Yes. Well, since it is Black Maternal Health Week, maybe the most searing statistic to come to grips with is the high maternal mortality ratio in the US and in Delaware.
Yeah.
Now, Delaware's maternal mortality rate is on par with the nation, which is not great when compared to other industrialized and high-income countries across the globe. So we have about 17 deaths per 100,000 live births in Delaware that are pregnancy-related. Yeah. And as I mentioned, that's similar to the US statistic of 18 deaths per 100,000 live births.
And what's coming out of those stats is about 75%, so 3/4 are preventable, right?
Actually, in Delaware, from the work of our maternal mortality review, we see over 80% preventable deaths.
Now, when are these deaths happening? Because again, for someone who just had a baby, right? And the baby, they're home and they think they're in the clear. They were able to go through the labor, they had the baby, their baby is home with them. Tell us, when do those deaths happen? What's the majority of the timing of when those deaths occur?
Well, it differs a little whether the death is pregnancy related, like causally linked to the woman's being pregnant, or if they're not. And you know, in Delaware, we are small enough that we look at any death of a woman from any cause around that time before and after pregnancy. So if the death is related to pregnancy, we see a higher risk in the early postpartum period, from the day of delivery up to 6 weeks. Now, for most of our deaths that we review in the Maternal Mortality Review Committee, actually 80% of them are not pregnancy related, but they're also very important deaths to review, because these are the causes that are killing young women in our society. Overdose, substance use disorder, violent deaths, and motor vehicle collisions. Most of those deaths not related to pregnancy are occurring in the late postpartum, so 6 weeks up to a year after the delivery. And about over 2/3 of deaths that are not related to pregnancy do happen later in the postpartum.
So more than 50%. So that means that that child is still at the risk of being raised or living a life without their mother. Right? So when we think about that, right, and we think about, you know, you were able to have the baby, you got out of the hospital, you're home with your baby. What are some of the kind of opportunities that we can ensure that we kind of really attack the causes that happen in that late postpartum period?
Yes, great question. And I think actually there are two pieces of the data story that point us to the postpartum, Shonda. One is, as we've mentioned, the maternal deaths that occur in the late postpartum. But we also see through our fetal and infant mortality review just the suffering that can also happen in the postpartum. Now, again, because of the vantage point we have in looking at the worst possible outcomes, you know, we're seeing stories of moms who've lost their infant, either their baby was stillborn or they didn't get to take their baby home. And so they really have kind of a twofold, I'd say, almost crisis of suffering. First, because many of them had pregnancy complications that will affect their health, their physical health in the postpartum. But then they have the mental health complication of dealing with their grief. Many of our fetal and infant mortality review cases, the woman also had depression or anxiety. And then because of her loss, also develops post-traumatic stress disorder. So
or psychosis.
Or something much more emergent, like psychosis. So they have mental health, they have their grief, they have physical complications. So for them, especially, that postpartum period is so key.
So it's a flurry of things, right? And I just want to throw out some numbers. 1 in 5 pregnant women and birthing people can experience anxiety or depression. And that is not only in the postpartum, it could be during the pregnancy, when they find out, when they go to the prenatal appointment, it can be in labor.
Yes.
And so we want to recognize that and kind of elevate that. So we think about mental health, right? And then also the challenges of breastfeeding, of not sleeping, right? And one of the things I love to always highlight is doula care. And can you talk about doula care? Because Delaware, you guys have been incredible in your legislative efforts to just really focus on maternal health, having doula care, having that compensated, right? Also extending Medicaid for the duration, that 1 year after giving birth. So, I applaud all the efforts that have been done with the Delaware Mama Bus, but, can you talk about doula care and how that can be impactful?
Yeah, that is a very important aspect of this work, one that many of the partners that we work with through the commission are focused on. So doulas, we have prenatal doulas, delivery doulas, postpartum doulas, and as you mentioned, in 2022, the Delaware General Assembly passed a suite of legislation, 6 to 7 bills that they termed the Momnibus, because they really did have this maternal child health focus. And one of those bills was to extend Medicaid reimbursement for doulas. There's a certain number of prenatal visits and postpartum visits that will be covered by Medicaid. And I just heard today at a conference we both attended that 3 additional postpartum doula visits are now included in the Medicaid package of reimbursement. So that's so important. We've also got a lot of good community partners who are training doulas. So Medicaid's got a reimbursement piece, and then we have partners like the Black Mothers in Power group based here in Wilmington, but working across the state that has doula training. The Do Care Doula Foundation also offers training. There are some programs downstate that had grant support for training. So again, not only reimbursement, but increasing knowledge and getting more community members trained as doulas. I think they then share with their families and their neighbors what a doula is, why it's important. And then the third really important partner that is coming along, I definitely feel like progress is being made, is the hospitals. We know some great examples of hospital staff, inviting the doulas in to give them a tour of their labor and delivery suites. Doulas are a little bit newer in the hospital setting, and you can speak more to that.
And just welcoming them into the obstetrical care teams.
Right.
Be part of the huddle. Let's talk about what patients are on the floor in labor and delivery. I kind of look at it like the doula is the third arm, right? So you don't have 2 arms, you have 3, right? And so they're able to kind of help you navigate those pathways that can be very difficult or stressful. Again, a lot of hormonal changes are happening. And, and also we forget that with pregnancy, we forget a lot. This is why I always encourage my patients to write things down, because pregnancy brain is a real thing. And what I will say also is kind of as we look at who is impacted the most with maternal deaths, right? We know that Black women are disproportionately impacted, right? But we know their leading cause of maternal death is cardiovascular disease. So when I think about kind of who's listening to us now, those who made it home from the hospital, but they still may have high blood pressure. They still may have diabetes. They still need to check in with their doctors. We think about, I said the doula is the third arm. We said that pregnancy is 3 trimesters, first, second, and third. Well, we like to think about that 4th trimester, and that's the postpartum period. Making sure you make it to those appointments, seeing if we can get appointments earlier, if sooner, having a blood pressure check, or even making that a telemedicine visit, right? We learned a lot from COVID. That's one of the elevations of the virtual platform. So can you speak to that and how there is an encouragement to really attend those postpartum visits?
Yes, we are one of our key partners in the work that the Maternal and Child Death Review Commission does is the Delaware Perinatal Quality Collaborative. So it is a consortium, a group of all of the birthing facilities in Delaware who meet regularly, both their obstetric staff members and pediatric staff members. We have 2 working groups. And one of their initiatives that came out of, again, recognizing the postpartum period is a very vulnerable time for mothers, for their own health, for the health of their infant. One of their initiatives is the 4th trimester initiative. And so they are rolling out a suite of tools to help providers and hospitals schedule that early postpartum checkup even before the woman goes home from after delivery. And not waiting till 6 weeks, but getting that checkup scheduled within the first 2 or 3 weeks. Maybe even sooner if she had a complication like high blood pressure or any kind of risk factor or presentation with depression. So getting that first and early postpartum checkup scheduled, making sure that the mother knows that information before she goes home from the hospital. And then, depending on capacities, we see different sites tackling that postpartum visit, taking it on differently, whether that's an in-office visit or a checkup over the phone. Today I was speaking with a colleague from the Red Health Center in Sussex County, and they have grant funding and are bringing on a community health worker and a doula. And their doula will be doing that early check-in by phone about 1 week after delivery. And if the mother then describes any risk factors, she will get scheduled for that 2-week in-clinic checkup. So it can look a bit different depending on where you're practicing and how big your clinic is. But having, telehealth options, in-person options, nurse midwives, nurse practitioners, doulas, and of course OBGYNs and family medicine doctors as part of this team. We got to use all the resources we can. We're a small state, and there are areas in our state that just don't have enough women's health providers.
And I think when we think of creativity, right, looking outside the box, do not leave the hospital without your appointments, right? If you had hypertensive disease, if you had preeclampsia or eclampsia, maybe you should not leave the hospital without a blood pressure cuff. Why are you not checking your blood pressure at home? Creating a blood pressure log, having that quick follow-up in 2 days or 2 weeks. Thinking about, family planning, if that's something that you want to consider as well. Making sure you have your doula or your community health worker. That's another very important member of the obstetrical care team because they bridge that gap between the medical community and the community from whence our patients come from. So it's kind of navigating all those spaces. And how do we make it easier? We want to return joy into motherhood, into that journey, into that space, because we can talk about the healthcare crisis across the country, but how do we kind of create solutions that are not only impactful, but also allow you to exhale and enjoy? Because that's the biggest thing. We want our patients to be at places of peace and to be at places where they can not have anxiety or depression, but enjoy that moment where they have just had one of the best days of their life and they have been able to, give birth and enjoy the miracle of life. So Dr. Meena Ramakrishnan, I have to thank you. You are an epidemiologist. You look at the numbers, you look at the facts, you look at the science. Thank you for what you do here in Delaware, evaluating maternal and infant deaths. We are so grateful to have people like you on our team that helps create solutions and all the work that you're doing to remedy this impact of this global, nationwide, and even statewide healthcare crisis. So thank you, and thank you for presenting all that information for our audience.
Thank you, Ashanda.
And we want to answer your questions. There are no stupid questions. Every question you have is valuable and it's important, and they should be answered. You are important. You deserve to have joy, and you deserve to have the best day of your life. and let us be part of that, answering the questions that you may have and making sure your voice is heard. Thank you so much for your time and attention, and please enjoy your life, your children.